Dr. Kelly Walsh worked on staff at the Animal Emergency Care Centers for 3 years, dealing with a wide variety of emergency veterinary cases. Dr. Walsh earned her DVM degree from Colorado State University and serves on the Harley's Hope Foundation Advisory Board. Her workshop is entitled Common Veterinary Emergencies.
So I'm Dr. Kelly Walsh. In case you guys didn't hear earlier, did several years at the local emergency clinic, and now I'm over at Yorkshire as a general practitioner. We're going to be talking today on veterinary emergencies and how to minimize your pet's risk to prevent them. The first one we're going to talk about is called parvovirus. It's a virus that affects dogs. It infects their intestines, their bone marrow, their lymphoid tissues. It's highly contagious and very easily spread from dog to dog. It's shed in the feces, and the infected dogs for about 1 to 2 weeks. Other dogs contact the parvovirus by coming into contact with the feces of infected dogs who are shedding that virus during that 1 to 2 week period. It can also live in the environment for several years, and is only killed by dilute bleach concentrations. Unvaccinated or even partially vaccinated dogs are highly susceptible, puppies being the most common that we see because they haven't had all of their series of shots yet, but adult dogs, if they've not been vaccinated as a puppy, are also highly susceptible to it as well. It can be spread in boarding kennels, dog parks, grooming, breeding facilities, or even in people's own backyards. Signs of infection start about 3 days to 2 weeks after the dog's actually been infected. With aggressive treatment, 80 to 90% of dogs will actually be cured and go on to live a normal life, but without treatment, it is almost always fatal. Signs of parvovirus: anorexia, not eating, lethargy, vomiting, bloody diarrhea, as you can see in this picture, dehydration, fever, and weight loss. How do they diagnose it? Get them into your veterinarian. They will get history from you, their vaccine status, and they'll do a physical exam on the dog as well. They do an in-house SNAP fecal test, which looks for the virus being shed within the feces of the dog. They may also do complete blood work to investigate any bone marrow involvement as well. Hospitalization, as I mentioned before, it gives you the best treatment. 80 to 90% of hospitalized dogs can survive. But without aggressive treatments in a veterinary hospital facility, the recovery rate drops dramatically, and like I said, most often is fatal. So what do they do in the hospital to treat these puppies? They give them very high rates of IV fluids to treat the dehydration. They give them IV antibiotics to treat bacterial infections secondary to the virus. They give them anti-diarrhea and anti-vomiting drugs to help clear up vomiting and the diarrhea. They may give them sugar, blood sugar, if their blood sugars are low due to not eating, especially the smaller breed dogs. And sometimes they even need plasma transfusions. How do you prevent parvovirus? A complete series of vaccines by a veterinarian is the only good way to do so. Not just 1 or 2 vaccines, but a whole series of 3 to 5. And then also cleaning up the environment of any infected dogs so that they're not shedding it or spreading it to other dogs. Again, disinfecting all exposed surfaces, throwing away things you can't bleach, minimizing exposure to unvaccinated dogs, and once again, vaccines are the very best way to prevent it. Key points about the parvovirus: it's a very deadly, very highly infectious virus. It shows up as depression, appetite loss, vomiting, diarrhea, and dehydration, as well as fever. Most dogs die without appropriate treatment, but vaccination can prevent it entirely. The next one we're going to talk about is heartworm disease in dogs and cats. A lot of people don't feel like we see this very often in Colorado, but we actually do. Heartworm disease is a common condition found, like I said, throughout the United States, most commonly in the Southeast and Hawaii, but also through the entire country. It's caused by a little thread-like parasite called Dirofilaria immitis. And here's a nice little map, and you can see here, we're kind of right in this region where we see 1 to 25 cases per clinic per year. So definitely much more common than most people give it credit for. So how is it spread? Well, a mosquito bites an infected dog or a cat, picks up the larva in their bloodstream, and then it passes it on to another animal when the mosquito then bites that second animal. Within about 6 months, the baby heartworm, what we call microfilaria, they mature and then they migrate into the blood vessels, migrate to the heart and the lungs of the dog, where they grow up into adults and can almost fill the entire heart. And This is just a little schematic of, you have here your infected sick dog, mosquito bites the dog, flies over to this healthy dog, bites them, injecting the baby filaria into that dog, where they then eventually mature, migrate to the heart, and then that dog becomes a sick dog as well. What signs will you see as an owner? Coughing, maybe even bloody production, difficulty breathing, what we call exercise intolerance. They just don't want to go for their walks, they don't want to play anymore. They're just kind of generally tired and have no more energy. How do you know if your dog has heartworm disease? Get them into your veterinarian. They'll take a blood sample, which will test them for the heartworm disease. They may also do a physical exam. They might look at x-rays. They might need to do additional blood work as well, depending on the severity of the signs of your dog. How is it treated? It's treated by multiple injections of an nematicide to kill off the heartworm disease. This has kind of come in and out of production, so every once in a while there are shortages, so it makes it much more difficult to treat the dogs. But the treatment itself can sometimes be dangerous, so it's much more important to prevent it in the first place. And how do you prevent them from getting it? Again, any kind of heartworm preventative, there's multiple brands out there. If you go talk to your veterinarian, they're the best source for it, and they can talk to you about your individual dog and which brand is going to be best for you and your pet. Next, we're just going to go over some not so commonly known household toxins. The first one is sugar-free chewing gum. Anything with xylitol in it, whether it's chewing gum or even now that people are cooking with it more, anything that contains xylitol is very toxic to dogs. It can cause very low blood sugar. It can also cause liver failure. Dogs show signs of having low blood sugar within about 30 minutes of ingesting it, but the signs of liver failure can take several days before they really show up. Clinical signs you might see if your dog has gotten into this. They can get weak, they'll have difficulty walking, they may even have seizures if their blood sugar gets down low enough. Treatment for it, call your veterinarian, talk to them about inducing vomiting if the animal has ingested that chewing gum or whatever xylitol products within the last 30 minutes or so. Otherwise, take them straight into your veterinarian. If they're showing signs and they're actually sick, obviously get them in right away so they can be treated immediately. You can also give oral Cairo syrup if they're showing the low blood sugar signs to kind of help with that blood sugar until you can get them into a veterinarian. Grapes and raisins are also a very uncommonly known toxin. Nobody really knows why they're toxic, but it has been proven that grapes and raisins can be toxic. Fermented, like wine, they haven't really shown much problems with that other than the alcohol consumption. But grapes and raisins are definitely very toxic. As few as 5 grapes can kill an 18-pound dog, so it doesn't really take very much. Clinical signs are usually within about 24 hours of ingestion. They can have vomiting, diarrhea, again, appetite loss, anorexia. They can have abdominal pain, and they can also just be very tired and weak. Again, inducing vomiting if they've eaten them within 30 minutes, and again, contact your veterinarian for the best way to do that. If they're actually showing signs of being sick, get them in right away, where your veterinarian will do IV fluids and supportive care for up to about 72 hours, depending on how severe the toxicity is. Some veterinarians will even recommend just prophylactically giving them IV fluids if they've ingested it and we haven't been able to get them back up through vomiting. Over-the-counter medications. Many people just assume if it's good for me, it's good for my pet as well, dog, cat, whatever. But most commonly, it's not actually very safe. Most over-the-counter medications can be toxic or even deadly to your pets. One of the most common ones is aspirin. At one time, aspirin was actually used for dogs, and you can still find doggy-safe aspirin on the counters at the pet stores today. However, it has a very, very narrow safety range. Even like half of a baby aspirin can be toxic to dogs. It can cause bleeding into their gut, gastric ulcers, that kind of a thing. It can also decrease their bleeding just like in people. You take it so you bleed, or you clot less. It causes lower clotting abilities in dogs as well, which can allow them to be more susceptible to bleeding. Ibuprofen also has come and gone in favor being used as a pain medication for dogs because the margin of safety is so very narrow. A 10-pound dog can have complete renal failure with only 1,400 milligrams, or even just 400 milligrams, which might be your normal adult aspirin, can cause gastric ulceration and bleeding. A cat gets even half of that, and that will be toxic to them. Acetaminophen is absolutely toxic. It's causes anemia, it can cause bleeding, it can also cause other life-threatening conditions. And even, like it says, 10-pound cat, as little as half of an adult Tylenol can be toxic and deadly to them. And then it takes a little bit more for dogs, about 750 milligrams for a 10-pound dog. Aleve, naproxen sodium, is also very toxic. It again causes gastric ulcerations, and as little as 25 milligrams is toxic to your 10-pound dog. But most commonly they're sold in 200 milligram tablets, so even just a fraction of that tablet can be toxic to your dog. So, take home for this little section, always check with your veterinarian before you give any human medication, any over-the-counter medication to them. Make sure it's safe and make sure how much to give, as even if it is safe, oftentimes the dosage is very different than it is for people. If your pet accidentally ingests any over-the-counter medication, gets in the trash, chews open the bottle, whatever, call your veterinarian immediately. If it's after hours, you can call your local emergency clinic. You can also call the ASPCA Poison Control, which is open 24 hours a day, although there is a $65 fee associated with that. But they are oftentimes the best people to go to if it's something obscure, a very uncommon medication or something like that. Also, keep potentially toxic foods and medications out of reach of your dog. Lock them in cabinets, child safety locks, those kind of a thing. Just because it's child-proof, it is not dog-proof. They can very easily chew through those bottles, chew those lids off, and get into way more than they need to. That also goes for even dog medications as well. Even if it's been prescribed to your dog, make sure it's safe and out of reach so they don't overdose themselves on that medication. And then never leave trash out where they can get into it, because there could be any number of bad things in there for them. Next, we're going to move on to canine and feline heart disease. So it is a very common condition out there, and it's getting even more and more common as pets are living longer and longer. Knowing what signs to watch for is going to be extremely important, so you can pick it up, get your pet in, so that get them checked out. Routinely, yearly exams can be the best way to detect it as early as possible. Your veterinarian will listen to the heart, look for heart murmurs, check for other clinical signs that your pet might be showing the very early signs of heart disease. Dogs have any number of different common ones, anything from heart valve degeneration, congenital defects, things that they were born with, dilated cardiomyopathy is where your heart just gets too big, too thin, irregular heart rhythms, arrhythmias, kind of like AFib in people, similar things like that. Again, heartworm infection can also cause primary heart disease, and then tumors or cancers as they get older in life. Any breed and any age of dog can be affected. Like I said, there's some congenital conditions, so even very young puppies can have heart failure. And again, as dogs get older, they become more likely to have some of these other conditions. There are some types of dog breeds that are much more commonly affected than others, but again, any of them can be. As far as the small breed dogs go, you have your little Cavalier King Charles, Chihuahuas, Poms, your Min Pins, Yorkies, Maltese, all those little tiny lap dogs. Large breed dogs, Dobermans, Rottweilers, Boxers, Labs, and Goldens tend to be the most common. But again, any animal, any breed, any age can get heart disease. Cats, they really only have one super common one, and that's hypertrophic cardiomyopathy, where the muscles of the heart just get extra large, the heart can't pump properly, it can't pump as much blood as it needs to. But again, there are any number of different things they can get. This is just by far the most common one. Cats can also get a side effect of heart disease called an ATE, or an aortic thromboembolism, where they actually develop a blood clot down kind of near their back legs in their aorta, which cuts off blood supply, and then the cats actually become paralyzed in their back legs because their back legs are not getting any blood. Their legs can get cold. It's extremely painful to the cats, and it's definitely something you can't miss if your cat comes down with this, but something where if they get it, you definitely need to get them into veterinarian immediately. Common cat breeds, Maine Coon, Persians, and Ragdolls are the three most common, but once again, any age of cat, any breed of cat is susceptible to potential heart disease. Signs of serious heart conditions in dogs, the most common you'll see is shortness of breath. They might cough, they might not be as energetic, they may not want to go for their walks, they may not want to play anymore. They can actually collapse, they can lose weight, and they can get what we call cyanotic gums, where they're actually this bluish purplish color, and that's definitely get them into your veterinarian right away. In cats, it's a little different. They might pant. Anytime you have a panting cat, that's very bad. Cats do not pant like dogs. They shouldn't ever be panting. Like this cat is sitting here just breathing with its mouth open. That's a very bad sign, indicative of heart disease or very bad lung disease. They can definitely, again, not be able to use their limbs if they get those little thrombi within their blood supply. They'll lose weight. They won't eat as much. You may or may not notice exercise intolerance with cats, because they sleep so much as it is, but if you pick up on that, definitely let your veterinarian know. And they can also get the pale blue cyanotic mucous membranes as well. Diagnosis, physical exam, again, yearly physicals is going to be the best way to pick it up. X-rays of the chest, you can see here, that is the heart. It's taking up about 2/3 of the chest, which is way more than it should. So that definitely will give your veterinarian a lot of information. As well as you can see, there's a little bit of fluid building up in those lungs, which your veterinarian would pick up as well. They might also do an ECG to make sure that they're regular rhythm, or if it's an irregular rhythm, it'll tell them how it's irregular. They might do an ultrasound of the heart. They'll check the blood pressure, and there are certain blood tests you can do to look for heart disease as well. Goals of treatment, you're never going to cure heart disease. It's something that's always going to be present. The goal is to minimize the side effects from it and the clinical signs of it. So you want to prevent fluid from building up on those lungs, improve how well the heart is pumping, how much blood the heart is pumping, make sure it's a normal rate and normal rhythm, and there's any number of medications your veterinarian might prescribe based on your pet's individual heart condition. Again, key points, any age, any breed of animal, any sex, all of them are susceptible. If you note any of these abnormal signs, definitely get them into your veterinarian right away. And as I said, heart disease cannot be cured, but it can be medically managed to give your pet the best quality of life for as long as possible. There are also veterinary cardiologists, just like there are human cardiologists. You may wish to take your animals to get even more expert care and treatments. Next one we're going to move on to is called gastric dilation and volvulus. You guys might notice as GDV or bloat. A lot of people commonly call it, and it is absolutely an emergency situation. If you notice any of the signs we're about to talk to you about, get your animal into your veterinarian right away. So what exactly is GDV? So the stomach fills up with air, as you can see here, it gets kind of dilated, and then it actually, part of the intestines kind of wrap around and the stomach flips, and you can actually cut off the blood supply to part of the stomach or the spleen, causing it to die away, and it can happen very, very quickly. Again, loss of blood supply to the spleen, loss of return of blood flow to the heart, puts the dog or cat in shock very, very quickly, which again is why you need to get your animal into veterinary right away. It can kill dogs and cats within a matter of an hour or two. Who is most commonly to get the GDV? Any of your what we call deep-chested dogs, Great Danes, St. Bernards, you see they very tall, very narrow chests. These large breed dogs are definitely much more common to get it. However, any age, any breed can get it, and even cats, which most people don't think about cats. What causes it? Nobody knows exactly for sure. Feeding large meals and then letting them go run around and play can sometimes play a role in it. If they eat or drink too fast, getting older, stress, if they swallow air a lot, if they've got any kind of abnormal tumors or growths or anything like that in their gut, it can play a role in it, but doesn't guarantee it, but doesn't also prevent anything. What will you see if your dog has a GDV? They'll be anxious, they'll be up, they'll be pacing, they'll be trying to vomit, and they won't be able to bring anything up, except maybe just the tiniest amount of foam. Their belly will get big and bloated and painful, they'll be drooling, they can be definitely very uncomfortable, they might be doing a stretching their belly kind of posture. They won't want to eat because their belly is already very distended, and you can just tell that they're just not feeling well. The non-productive vomiting is going to be one of the more key indicators though, as well as the abdomen itself being pretty bloated. How do you diagnose it? Again, like I said, get them into a veterinarian right away, and they're going to do an x-ray to diagnose it, but if your dog is in enough shock, they may actually do some emergency treatments, get the blood pressure up, get the animal on some pain medication, help them get back out of shock before they really proceed much further. But again, an x-ray is going to be your key indicator, and this is an x-ray of a dog that's bloated. You can see this huge black structure, and this structure up here is all gas within the stomach, and you can see it's taking up almost the entire abdomen. It is so distended at this point in time. They may also want to look at blood work to determine how shocky they are and how critical the treatments need to be. Once the stomach is twisted, surgery is really the only way to get it untwisted, and they're definitely going to want to go to surgery right away. They will need, like I said, some IV fluids, some shock treatments if your dog or cat has gone into shock before going to surgery, just so they stabilize the patient. But definitely emergency surgery is going to be your end-all cure. Sometimes they will try to pass the stomach tube to decrease the compression factors, help get the blood supply moving, decrease the distension, help alleviate some of the shock, but that may or may not be possible depending on how twisted that stomach actually is. During surgery, the vet will open up the abdomen, untwist the stomach, evaluate the situation. They'll look at the stomach, they'll look at the spleen, see how long the blood supply was cut off for, how badly. If it was bad enough, they may need to remove the spleen or even part of the stomach if there was enough dying away of the tissues because of a lack of blood supply. And then they'll do what we call a gastropexy, where they'll take the stomach and they'll actually suture it to the rib cage so the dog cannot twist the stomach again. They can bloat again, meaning they can get gas buildup in their stomach, but they can't get that life-threatening twist anymore. How do you prevent GD from happening? The most surefire way is to have them prophylactically pexied. So instead of waiting till they bloat, going in for emergency surgery, doing that pexy surgery at that point, you can actually do it at the time of spay, at the time of neuter, or any time you want. They can do it laparoscopically now these days to minimize how invasive of a surgery it is, but that is really the only surefire way to prevent it from happening. Again, if they show signs of bloat, give them to a veterinarian immediately before they get to that shocky, life-threatening stage. Sometimes feeding multiple meals a day can help decrease the likelihood of it. Keeping them a little bit quiet, don't letting them run around immediately after eating may help, it may not. The next thing we're going to go on to is called intervertebral disc disease. So the spinal cord, just a little anatomy background real quick. Spinal cord is a thing running from your brain all the way down your back that does all the innervation to your limbs, to your organs, to your skin, everything. And it's surrounded by your spinal column, the vertebrae, that protect it and keep it nice and happy and safe. In between the bones are, so like this is a vertebrae, you've got this little disc, and it's a shock absorber between vertebrae. As you move, you twist, you run, you jump, you play, do all that kind of stuff. It kind of helps, it's your shock absorbers, basically. And it's made up of two layers. You have your fibrous outer layer, this darker pink here, and your jelly-like interior. And again, here's just another schematic. You can see the spinal cord running through here in the middle of all your vertebrae, and these are your little discs in between each one. The discs of young animals are mostly water, making them very, very squishy. As animals mature and get older, there's less water and they become harder and more firm and less of a shock absorber. And then when they become damaged, they can actually bulge any direction they want to. However, they most commonly like to go up, in which case you can see they can go up, put pressure on the spinal cord and the nerves coming out of the spinal cord, and that's where we get our problem. Signs can range from just simple back or neck pain, loss of sensation, paralysis, 2 limbs, 4 limbs. It just really depends where the disc has extruded. Sometimes even just 1 limb initially will be all you see. The more compression, the more severe your signs are going to be. Short dogs with long backs are more common to have intervertebral disc disease. So your dachshunds are your poster child for intervertebral disc disease, but corgis, bassets, any breed is susceptible. Even cats can get this disease as well. Most herniations are caused from what we call degeneration. As they're getting older, there's less water, they kind of break down their strong materials, they get weak, more likely to bulge out. So certain medical conditions can make them more prone to this as well, but it can also be trauma related. They get hit by a car, they fall down the stairs, things like that can also cause them to herniate their discs. Mild cases of intervertebral disc disease can be treated with cage rest. Basically, it's bed rest for dogs. They hang out in the cage for the majority of the day. They come out, they do a little bit of walking and moving around, going potty, that kind of a thing, but they're definitely not running, they're not jumping, they're not playing, they're not climbing the stairs, they're not wrestling with their housemates. They're keeping as calm and quiet as possible for the entire duration of the treatment. If it's bad enough, your veterinarian will definitely recommend surgery, and that will be the best way to get your dog up and walking around like normal again. Before surgery, they're going to recommend a CT scan or an MRI so they know exactly where the disc extrusion is, and they know exactly where to cut. So they're not making any larger of a cut than they necessarily need to, because they're actually going to have to come in here, and you can see here is a little bit of extrusion here. You can see a narrowing there. They're going to have to cut down to that bone, drill through the bone to get down to that disc, scoop it out, and relieve the pressure that it's causing on the spinal cord. Prognosis depends entirely on how much compression there is at the spinal cord. I think it says in the next one. Yeah, if the patient has sensation in their limbs, they have about a 90% chance that they're going to walk again with surgery. It's a little bit lower, more like 65, 75% without surgery. If they do not have sensation, then regardless of surgery or not surgery, the chances are going to go down to about 60%. Aftercare is going to be the big thing after surgery. This dog is going through some underwater treadmill rehab. Pain medication, again, you're still going to need to rest them while they recover. But yeah, physical therapy and that kind of thing. Sometimes dogs have trouble urinating and defecating, and sometimes you need to help them a little bit with that in the initial recovery period until they get better sensation down to those parts of their body. Some dogs, like I said, there's some chance that they will never walk again, but a lot of dogs do really well. They can have specially made carts, which is a doggy version of a wheelchair, and they can run around, they can play, they can chase ball and all that stuff and still have a pretty happy life with that cart, even if they do not recover full function of their limbs. If you think your dog is showing any of these signs, definitely get them in a veterinarian right away so they can get treatment as soon as possible. Questions about any of that? She was just asking, she's got an indoor-only cat that is seemingly pretty happy, pretty healthy, and she was just wondering if she should still go in for annual exams and how she should talk to her veterinarian so they're not running more tests than necessary. And the biggest thing is just get them in there for the annuals so that the animal can get looked at. They'll listen to the heart, they'll listen to the lungs, check for the heart conditions, just check dental health, check overall physical health. Depending on the age of the cats, they may not recommend anything more than that. Let them know that he or she is an indoor-only cat. Let them know their eating habits, what kind of food they're getting, that kind of a thing. And just let them know, like, I don't have any concerns right now. And then they may just kind of say, well, great job. She looks good, come back next year and we'll just kind of keep this up. As cats get older and more mature, then they may recommend yearly or every other year blood work just to check for kidney disease, liver disease, those kind of things. Or if you come in and you're like, she's just not eating as well, she's losing weight, that kind of a thing. Or they might even pick up in the records, last year she was 15 pounds, this year she's only 12. Why has she lost weight? Have you done it on purpose? Is she just not eating? That kind of a thing. But really, just communication with your veterinarian is going to be the biggest thing. Let them know what kind of life she lives or he, what you do. If you have no concern, say, I'm not really worried about her, I'm just here, I just want to make sure she physically is doing okay, and just kind of talk back and forth. And they should, if they're going to recommend any test, talk to you about it first, tell you why they're recommending it, what the basis is, and then you always have the option of saying no if you don't feel like it's necessary.